Our genes provide valuable insight into our family history, our ancestry, and also our health. As we learn more about our DNA, we identify new opportunities for healthcare. One such opportunity comes from using polygenic risk scores. In this video, you will learn what a polygenic risk score is, see how they can be used in healthcare, and find out how you can participate in research studies that use them. Polygenic risk scores. Why might you care about whatever they are? Knowing our risk of developing particular diseases can be a really powerful way to help us live healthier lives. Imagine you knew that you were at a high risk of having a heart attack. That's pretty clear motivation to do something about it, such as changing your diet or taking risk-lowering medication. But how could you know that you're at a high risk? A major risk factor for common diseases, such as heart disease, cancer and diabetes, is our own genetic makeup. New studies show that we can now analyze an individual's genes and actually measure that risk using something called polygenic risk scores. Our genes vary from person to person. It's why we're not all the same. But some of these genetic differences can contribute to our risk of complex diseases. There are a few rare diseases that are caused by changes in a single gene, but we now know that for the most common diseases such as heart disease and diabetes, it's often not just one or two of these genetic changes that are important. It's many of them, each having a small effect on the polygenic risk. Hence poly, many, genic, to do with genes, risk scores, scoring of risk. Scientists have compared DNA among gigantic groups of people with and without disease and have identified thousands of genetic variations that influence risk for hundreds of diseases. This important reference DNA from the studies can then be compared with individual patients' DNA to calculate their risk. So how could polygenic risk scores actually help you? A doctor's usual assessment of a patient might indicate one course of action, but when armed with a polygenic risk score, a different approach may become the better way to go. These scores could help doctors better identify specific medicines or therapies a patient is likely to respond well to, or whether they're likely to benefit from earlier screening for specific cancers. And because our genes don't change, as more of these variations are identified, your polygenic risk scores can be updated without having any more tests. Also remember, the same genetic information can be used to give you a polygenic risk score for lots of different diseases. So, we're stuck with the genes we have all throughout our lives, but even when they do mean our polygenic risk score of a particular disease is high, that doesn't mean our fate is sealed. There's lots we all can and should do to reduce our overall risk of disease, particularly if our polygenic risk is high. For example, patients with a high polygenic risk of type 2 diabetes can significantly reduce their overall risk through exercise and eating a healthy diet. So what's next? Well, you can see how much promise polygenic risk scores have, but there's still work to be done. Further studies are needed to assess the clinical impact of PRS in improving the diagnosis, treatment, or prevention of specific diseases. Also, studies must be extended to cover a wider global population. But already, polygenic risk scores are a promising new tool. By taking them into consideration along with other risk factors, they have the potential to help us live longer, healthier, and happier lives. To learn more about polygenic risk scores and how you can take part in research studies involving PRS, please visit us at cpm.well.ox.ac.uk/PRS.